Alright, everyone, here we go again with another episode of Optimal Anesthesia. The topic of diagnostic muscle biopsy under anesthesia is our focus today. We'll simplify everything for you so you know exactly what to expect. If you work in the anesthesia or are just interested in learning more, you should definitely listen. What exactly is a diagnostic muscle biopsy, to begin with? Myopathies and neurodegenerative disorders are only two examples of illnesses that this method is used to study. When it comes to anesthesia, however, there is no universal rule. Let's examine each factor in turn. First, let's talk about the types of muscle biopsy specimens. There are three main categories. 1. Standard anatomical muscle biopsy. This one is pretty straightforward. There are no specific anesthetic requirements for this type of biopsy. 2. Contracture test. If a patient is suspected of having malignant hyperthermia susceptibility or needs in vitro contracture testing, a non-triggering anesthetic is essential. We want to avoid both a malignant hyperthermia episode and any interference with the contracture test. 3. Mitochondrial enzyme analysis biopsy. Some metabolic clinicians or pathologists may recommend avoiding propofol for this type of biopsy, but it's important to note that all anesthetics can affect mitochondrial function in vitro. Before the biopsy, there's a pre-anesthesia assessment. This is similar to what's done for all patients with myopathies. The anesthetic technique chosen largely depends on the patient's age and cooperation level. Regional anesthesia, for cooperative adults and older children, regional anesthesia with or without sedation can be used. However, in some cases, general anesthesia is required. General anesthesia, this is usually necessary for children and patients with developmental disabilities. Now, the choice between volatile anesthetics and propofol can be a bit of a conundrum. The best choice depends on the likely diagnosis, which brings us to our next segment. Patients undergoing muscle biopsy can be divided into 4 groups based on their likely diagnosis. Let's go through them. Patients at risk for malignant hyperthermia, MH. These are individuals suspected of having a congenital myopathy associated with MH. They should receive a non-triggering anesthetic to prevent MH episodes. This means avoiding succinylcholine and volatile inhaled anesthetics. Patients at risk for anesthesia-induced rhabdomyolysis. This group includes those with high preoperative creatine kinase (CK) or suspected muscular dystrophies. They, too, should receive a non-triggering anesthetic and ensure the anesthesia machine is free of inhalation agents. Metabolic myopathy suspected volatile anesthetics are an option here, but propofol should be avoided due to a small, unquantifiable risk of propofol infusion-like syndrome. No clear suspected diagnosis. For this category of patients, it's best to avoid volatile inhaled anesthetics and use intravenous, 4. Anesthesia with or without nitrous oxide if regional anesthesia isn't suitable. To wrap it up, anesthesia for diagnostic muscle biopsy is a carefully tailored process. It's essential to consider the patient's diagnosis, the type of biopsy specimen, and any specific risks associated with anesthesia. With the right approach, we can ensure patient safety while obtaining the valuable information needed to diagnose and treat myopathies and neurodegenerative diseases. Thank you for joining us today on Optimal Anesthesia. I hope you found this episode informative and engaging. If you have any questions or topics you'd like us to cover in future episodes, please reach out. Until next time, stay curious and stay healthy.